हाँ, स्टार्ट करने के लिए क्या करना है? हाँ, स्टार्ट करने के लिए क्लास स्लाइड शो में कर दें इसको। हेलो, हाँ, आई एम डॉक्टर राजीव, स्टार्टिंग विद द इम्यूनिटी. This is the revision classes for the immunity. Immunology already started for that one. Already we have covered before. That is going to be the immunities. Define immunity. First thing, resistance exhibited by the host towards injury caused by the microorganisms and their products, or the reaction of the body against any foreign antigen. Now coming, what are the types of the immunity? It can be the innate immunity or it can be the acquired immunity. Innate immunity by birth, that is a native immunity. It can be the non-specific or the specific. Acquired immunity, that is in their life with the different means or the vaccines they are going to get the acquired immunity. That may be active immunity or the passive immunity. Active and the passive immunity may be the natural or the artificial. Now one question you are going to get in the final examination for the 2 marks or the 4 marks, that is going to be the difference between the innate immunity and the acquired or adaptive immunity. Innate immunity is the resistance to the infection that an individual possesses from birth, so that is going to be inherited from the mother. Acquired immunity, resistance to the infections that an individual acquires during his lifetime. So you can have the difference for that one. By birth, what is the resistance is going to get? It is going to be innate immunity. What is going to be during the lifetime? They are going to have the acquired immunity, that is resistant to the infection. In immunity, immune response occurs in minutes. Immune response occurs in days. Prior exposure to the antigen is not required at all in case of innate immunity. And in acquired one, developed following the antigenic exposure. That antigen is going to elicit, antibody is going to be formed, that is going to give the immunity in the acquired. But in the innate immunity, there is no antigen is going to be required, no exposure, nothing is going to be there. Only by birth through the mother it is going to get the thing. There is diversity is limited, acts through the restricted sets of reactions, more varied and specialized response in case of the acquired immunity. Innate immunity, immunological memory response are going to be absent, where is going to be immunological memory response are going to be present in the acquired immunity. So what is the immunological response? Anyone? When you have the same antigen is going to be inflicted, the immunological memory is going to respond for that one, and the more amount of the antibodies is going to be the form. That is in case of the acquired immunity only. That is the when we are going to get the booster doses, more immunities antibodies are going to be formed. Innate immunity respond to the microbial agents that are not specific to some microbes rather than shared by the many microbes, so-called microbes associated molecular pattern. Respond to the specific microbial antigens. Host cell receptors are non-specific. In adaptive or acquired, that is going to be specific. T cell receptors or B cell immunoglobulin receptors are going to be there. Now in short, innate immunity is due to the genetic and constitutional makeup of the human being, not affected by the immunization, prior contact with the microorganisms. It is going to be non-specific or specific. Non-specific, resistant to the infection in general, specific, resistant to the specific pathogens. They are going to have the different levels of the immunity. The species level, that is mechanism is going to be physiological and chemical differences between the tissues of the host. Racial levels, some races are going to be resistant with the some infection and some are going to be the other. Example, Algerian sheep are going to be resistant to the anthrax, and whereas person with the sickle cell anemia is going to be resistant with the infection with the Plasmodium falciparum. So this is going to be racial levels. Individual level difference between the twins, homozygous twins shows the same degree of resistance and susceptibility to the tuberculosis and the leprosy. Factors influencing the innate immunity, that is age, that is extreme of the age are going to be susceptible to the more infections. Hormonal influences, diabetes, hypothyroidism, adrenal dysfunctions are going to be more liable for the infections. Nutritional malnutrition is going to be having the decreased immunity to the infection. The protein energy malnutrition lowers the C3 level, factor B interferon response and neutrophil activity. Mechanism of innate immunity, that is a epithelial surface, intact spine, mucous membrane, mucosal of the respiratory tract, that is the architecture of the nose, mucous lining of epithelium, cough reflex, cilia on the respiratory epithelium, nasal secretion, alveolar macro, that is going to protect the entry of the bacteria through the nose. Intestinal systems, that is going to saliva, it is going to be also having the bactericidal activity that is going to protect us with the different infection, giving the innate immunity. Acidic pH, stomach and the proteolytic enzymes is going to be the degrading the bacteria which is going to induce mucus lining in the intestine, bile salts and the fast flow contact. Resident flora of the large intestine. Conjunctiva, there is a flushing action of the tear. Lysozymes in the lacrimal sacs are going to be the acting as also as the washing, and the lysozymes also acting as a bactericidal agents. Renal apparatus, flushing action of the continuous flow of the urine. If it is any blockage of the urine flow in the system, it is going to be lead to the infection and decrease immunity for that. The spermine and zinc also going to act as antibactericidal. Acidic pH of the vagina, thick mucus plugs in the cervix is going to be protect with the infections. Antibacterial substance present in the blood and the tissues are going to give the innate immunity also. That's a complement system, beta lysine, leucine and the planktons, lactic acid in the muscle tissues, lactoperoxidase in the milk and the interferons. Microbial organisms resistant in the normal flora prevent the colonization of the pathogens. Prolonged antibiotic use also going to decrease the resistance. Cellular factor, role of the phagocytes is having the defense mechanism. Macrophages are the morphonuclear leukocytes. Macrophages are going to act as the preventing the infections, acting as an immunity. Histocytes in the reticular endothelial cells, monocytes in the blood, natural killer cells and NK cells are the active against the tumor cells and the viruses. Inflammations, acute phase protein, that is the CRP, metalloprotein, serum amyloid is going to activate alternate pathway, increase host resistance, prevent the tissue injury and the promote repairs. Fever, natural defense mechanism, activate interferon and restrict the infecting pathogens. Now coming to the acquired immunity. Now we are facing the problem with the different viral infections, mainly now the COVID. So all are talking about regarding the immunity and only immunity. What are the different ways of the immunity? According to their own choices, they have going to take either drinking with the hot water, kadha, with mulethi, gargling, exercise, yoga, all are going to increase the immunity that is acquired on during your lifetime. So that is the acquired immunity resistance that is individual required their lifetime. It may be active immunity or passive immunity. Active now can also be the natural or the artificial. Passive also may be the natural or the artificial immunity. Now coming to the active immunity or the adaptive immunity. It is nothing but resistance developed by individuals as a result of antigenic stimulus. Without that, nothing is going to be there. So the stimulus is going to be there. Macroorganism antigen may be any pathogens, any organism or any product of the organism. Adaptive response to a specific pathogens or the antigen. Synthesis of the antibodies and the production of the immunological active cells is going to contribute. What are the characters of the active immunity or adaptive? Sets after a latent period. So it takes some time to develop the immunoglobulins. So that they are going to be latent period. Includes initial negative phase. There is no immunity is going to be that at that time. Long lasting. Once it is going to be produced, it is going to be long lasting. Can experience secondary response. Immunological memory is going to be there. That means they can recognize the initial antigen stimulus when again it is going to be inflicted. More effective than the passive immunity. That means active immunity is going to be more effective than the passive immunity. Passive immunity, resistance transmitted passively in a ready-made form. So all are going to be prepared now, on nothing to do with that one. It is going to be introduced immediately when required and it is going to act immediately. Just like a prepared food. You have not to purchase so many things, vegetables, dal, rice and all these things to prepare your meals. Just get a ready-made food. Just canned food or ready-made food for that one. Just order that one, immediately you can eat. Just like that, passive immunity is going through there. There is no antigen, no role of immune system, no antibodies are going to be formed. There is no immunological memory. Administration of the preformed antibodies are going to be there. So what we are going to, that immunoglobulins or antibodies which is going to be preformed, we are going to introduce. They are going to act against the antigen and going to neutralize and give the immunity. Now the character of the passive immunity, no latent period. Why? Because all things ready-made. The antibodies and the immunoglobulins are going to be ready-made against the antigen. It is going to directly act. So there is no period for the formation, going for the cycle and the things. No negative phase because they are going to act immediately. Only transient. So they are going to, for the short period they are going to act. No secondary response. Immune elimination is going to be there. No immunological memory. Once there is going to be prepaid, there is no antigenic stimulus, no immunological memory cells going to be there. They are not recognition of any antigen. Less effective than the active immunity. Though all things are going to be negative side for the passive immunity, but what is going to be important for the passive immunity? Because one thing is most important, it is going to be as a used as a treatment also. It is going to act immediately. So for the so many dangerous diseases, we are going to give the passive immunity. What is the example for the immediate action passive immunity? Anyone? In diphtheria we are going to use the ADS. Against the diphtheria toxins we are going to use the anti-diphtheric serum. That is going to be immediately used. In tetanus, tetanus immunoglobulins are going to be used. In the severe case, in the high dose we are going to use the immunoglobulins against the tetanus. That is going to be most important for that one. Now, one question frequently asked in the final examination: difference between the active immunity and the passive immunity. It has to be written in the tabular form. Active immunity produced actively by the host immune system. So once antigen is going to be there in the host immune system, it is going to be act for that one, activation of the immune system and producing the antibodies. Passive immunity received passively by the host. That is going to be ready-made immunoglobulins or antibodies. Induced by the infection or by contact with the immunogens, active immunity, that is the vaccines or the allergens or any microbes. No participation by the host immune system in case of the passive immunity. In active immunity, affords desirable and effective protection. Passive immunity conferred by the introduction of the ready-made antibodies or the immunoglobulins. Active immunity effective only after a lag period, that is time required for the generation of the antibody. So after introduction of the antigen or any inflect or any allergens, it requires some time to produce antibodies through the immune system. So that is known as the lag period. In passive immunity, protection transient is going to be transient, that is for the shorter period, and less effective immunity immediately. But it is going to be effective immediately. There is no lag period, no negative phase is going to be there in case of the passive immunity. Immunological memory present in active immunity. Subsequent challenge more effective, that is the booster dose. When you are going to give the booster dose, they are going to recognize the same antigen which has been given before, and immunological memory is going to be active and produce more antibodies. Passive immunity, no immunological memory is going to be there, so subsequent administration of the antibodies is going to be less effectivity due to the immune elimination. Negative phase may occur in the active immunity, no negative phase in case of the passive immunity. Active immunity not applicable in immunodeficient host. Passive immunity applicable in the immunodeficient host, as it is going to be the immunodeficient, that is the immune system is going to be defective, so they are going to be the active for the passive immunity. So these are the differences between the active and the passive immunity. Now active immunity in details, that is going to be natural or artificial. Naturally active immunity results from the clinical inapparent infections by the microbes, long lasting, but duration depends upon the nature of the pathogens. Immunity follows. Bacterial infection is less permanent than the viral. So viral vaccines are more popular than the bacterial vaccines. Pre-immunization is nothing but immunity during the infection time only. As long as the original infection is going to last, immunity is going to be there for the reinfection of the same pathogens. That is pre-immunization. The best example is going to be the malaria and the syphilis. Artificial active immunity, resistance induced by the vaccines. When you are going to take the different vaccine, either it is going to be the bacterial or viral vaccines, the artificial immunity is going to be the occurred. The vaccines are the preparation of the live or killed microorganisms or the products used in immunizations. Different types of the vaccines, maybe the bacterial or viral, live, killed, subunits are going to be there. So we are not going to give details for that, and simply the bacterial live vaccine BCG, killed one cholera, subunit typhoid VI antigen, bacterial products tetanus toxoid, viral live vaccines OPV, oral polio, killed IPV, intramuscular polio vaccines, subunit is going to be the HPV. Live vaccines initiate the infections without causing injury or the disease. Immunity lasts long, requires booster doses. It can be given oral or the parenteral route. Killed vaccines less immunogenic. Immunity is going to be short-lived. Repeated administration is going to be there, At least 2 doses can be given, mostly parenteral dose. When you are talking with the live vaccine and Killian, one is going to be important. What type of the vaccines can be given in case of the immunosuppressed or the immunodeficient patients? That is going to be given killed vaccine also, not the live vaccines. Okay. Natural passive immunity and artificial passive immunity. Resistance passively transferred from the mother to the baby. When there is at the time of the delivery, from mother to baby, some resistance is going to be transferred to the mother. That is going to be placental transfer of the antibodies from the mother to the child. IgA through the colostrum. Active immunization of the pregnant mother. Passive immunity in the infant. It is going to be the tetanus toxoid. It is going to be there. Artificial passive. Resistant passively transferred by the administration of the antibodies or immunoglobulins. Used are hyperimmune sera, ATS, anti-tetanus serum, not used now. Convalescent sera, pooled human gamma globulins are going to be used for the prophylaxis and the therapy also. Mainly rabies. We are going to use the active and the passive immunity for the rabies. For that one, immunoglobulins are going to be given at the site of the infection also. Hyperimmune sera, equine ATS, temporary protection, hypersensitivity, immune emulation is going to be human TIG, tetanus immunoglobulins, long lasting protection. Convalescent sera is the serum from the patient recovering from the infections. Now you have knowing that one. In the convalescent sera, the plasma is going to be used in case of the serious COVID patients. Those who have suffered with the COVID, their plasma is going to be pulled out and taken, and the IG immunoglobulins are going to be measured whether the antibodies are going to be there. If the high antibodies are going to be there, that convalescent sera is going to be used for the saving the life of the risky or the terminal case of the COVID, but is under trial. Something is going to be better than nothing. So some lives are going to be saved with the convalescent sera of the COVID also. Pooled human gamma globulins, antibodies against all commonest pathogens prevalent in the regions, used in the immunodeficiency disorders and the viral vaccines. Only IM route should be advised. Advantage: immediate and the temporary production for suppression of the active immunity. Combined immunization, active and the passive production. When you are going to active and the passive both at a time, suppose you have the tetanus for that one, then you have the active and the passive both at a time has to be started for that one. Adaptive immunity, injection of the immunological component, lymphocytes, that is going to be transferred. Local immunity, immunity at the site of entry of the pathogens, mainly poliomyelitis, intestinal immunity in the poliomyelitis, nasal immunity in the influenza virus, and the mainly by the IgA antibody. So influenza virus vaccines, there is a live vaccine, it is going to be nasal spray through the nasal, which is going to be give the local immunity, and intestinal immunity for the oral polio, it is going to be given oral dose, for that one giving rise to the local immunity also. Herd immunity, so we are now acquainted with these terms frequently for that one, when the herd immunity is going to be occur for the COVID or not, what the time it will take and how many years it is going to take for the herd immunity for that one. Herd immunity is nothing but it is going to be overall level of the immunity in the community. That means apparently or inapparently all the person is going to be infected, having the immunity with the COVID or any disease, it is going to be having a sufficient amount of the antibodies to fight with that infection. It is going to be the, so there's a localized area or the community is going to be having the immunity. this controls the epidemic diseases. So epidemic or the pandemic, it is going to be there, it is going to be the herd immunity only, it is going to control and restrict the diseases. If decreased herd immunity, there is increased chance of the epidemic. So it is clear now, if there is herd immunity is going to be increased, there is a chance of the epidemics or the epidemic is going to be decreased. So hope so in the future we are going to be herd immunity against the COVID and going to be free from the COVID. Now you have the questions. Just write the answers on the comment box in 5 minutes and send to me. Those who are going to answer the questions only, they are going to get the attendance. Without answer, no attendance. Now I think 5 minutes over. So now I am giving the answers for the things. Just tally your answers. Just go through the answers, what are going to be there, match with your answers, whether it is going to be correct or not. So go through all the things for that one, especially in the immunity. Innate immunity. What is innate immunity? You have to give in details for that one. Second, difference between the active and the passive immunity. And sometimes or frequently they are asked for the herd immunity. Define herd immunity for 2 marks. These are the 3. Or sometime they are going to ask for the give examples for the live viral vaccines, killed viral vaccines, or the live bacterial vaccines, or only bacterial vaccines. So you have to enumerations for the 4 of each you can remember for that one. In the virology classes prophylaxis also we have given all the live vaccines examples. Remember that one. Okay, good luck. Hope soon we are meeting after the starting the class, that is physically. May in the next month or after 2 months develop your herd immunity and decrease the epidemic and also the pandemic. Thank you.